you could come. It looks like it's gonna rain out there. Yeah, it started already. Okay, well, I'm glad you made it inside. Yeah, so I know you said that you were free to hang out today for a little bit. Okay, cool. I was wondering actually if I could practice a little bit on you. I've been learning nursing a bit lately and hoping to get my PhD, so I'm training a lot of skills, and for kind of homework we have to practice. So I was wondering if you would mind. Really? Okay, cool. Nothing's invasive, and I'm not going to use any needles or anything like that, so it should all be really simple. I do have to go through all the motions though, pretty formally, so is that okay? Okay, I'm not going to give your information or anything, it all stays really confidential. I'm just going to write it down. We have forms for school that we have to fill out just as we go along. Is that okay? Okay. Yeah, your name won't be on it or anything. Oops, that's not the right page. Okay, you doing all right? Yeah, that's not Dr. Me asking. Yeah, I know it's been really hard lately. Well, if you do have anything you want to talk to me about, definitely you can talk during the exam or after. We can just chat. Okay. Alright, so we will get started. I'm just gonna call you patient 1. Okay, and do you know your height and weight? Okay. Alright, and eye color. And are you left-handed or right-handed? I know a lot of these answers, but I have to ask. I know. Thanks for being cool about it. Okay, what is next? Okay, and date of birth. Okay, cool. Alright, and do you have any history of chronic illness or any, are you taking medication for anything? Do you know of any issues that you have or have had in the past? Okay. Did you have surgery with that or anything? Okay. Alright, and you're on medication for anything? Okay. And you don't have any chronic illnesses? Oh, okay. And that affects your stomach? Okay. Do you change your diet or anything for that? Okay. And do you have any allergies that you know of? Penicillin, okay. So usually people who are allergic to one of the cillins are allergic to all of them. But obviously I'm not going to be giving you any medicine. It's just a precautionary question. Okay. Well, let's get started if you're ready. Okay. I promise it's going to be really easy for you. It will be much harder for me. Can I come close? Okay, cool. So the first thing I'm gonna do is listen to your heart. Okay. So I'm just gonna warm this up a little bit because it can get really cold. Yeah, you can lift your shirt if you want. It doesn't matter. Okay. Alright, I'm gonna go right on the front here, and you can just breathe normally. Good. Heartbeat sounds good, really strong. Were you rushing at all to get over here? Yeah, it's just beating a little fast, but that could definitely be just nerves. Okay, I'm going to put it on your belly now and listen to your stomach sounds. Okay. Okay, I'm just gonna feel now in your stomach. Is that uncomfortable? Okay, good. I'm just gonna push down on your abdomen here on the left and on the right. Okay, good. All of your organs feel fine. I'm going to push in the middle and you tell me if you feel any uncomfortable pressure, okay? Does that feel alright? Okay, good. Cool. I think your stomach is good. Have you been having any troubles lately outside of the norm? Has your diet changed recently? A little bit? Oh yeah, it has been hard to find a lot of stuff at the store. So you've been eating more carbs than usual? Okay. Anything else you've noticed change? Are you getting fewer vegetables, fruits? Maybe veggies, okay. Right, for that I would definitely, I know that a lot of the frozen food has been gone, but if you can't find any of the fresh produce or you don't want to bother with it right now, sometimes the frozen food section has really good vegetables, and a lot of times they're more nutritious even than some of the fresh stuff which has been shipped around. Yeah, I know it's weird. You always think that the frozen stuff is less healthy, but okay, so at least you're aware of that and you know that those are probably the reasons. So I would just say if you're not too uncomfortable, keep doing what you're doing and just, fix it when you can. If it does become unbearable though and you have a lot of stomach pain, I would just try really hard to come up with alternate ways. I know it's difficult right now. Yeah, I've been going through the same thing. Okay, I'm gonna listen around your back, okay? To your heart again. So let me just put this here. Is that okay? Alright, can you take a deep breath in for me? Good. And again. Okay, and on the other side, I'm gonna have you hold your breath at the top. So take a deep breath, hold it, and then I'll tell you to release, okay? Alright. Alright, breathe in. Hold it. And release. Good job. One more time on the low back. Breathe in. Hold it. And release. Good. Your lungs sound fine. Your heart sounds healthy. As I said, your heartbeat was a little fast, but that could just be because this is weird and we don't usually do this. Yeah. So you feel fine though. Okay. So your heart sounds good, and your lungs, I don't hear any rasping, gurgling, no signs of an infection, so that is of course excellent. Okay. And next I need to take your pulse. Okay. So if you'll just give me your arm here. Okay, ready? You can just make sure you're relaxed, uncross your legs, and just chill. Okay. Okay, sounds good. Feels good, I should say. Okay, I'm going to do the other side now. If you'll give me your other arm. Okay. How is the pressure of my fingers? It doesn't hurt or anything. Okay, I'm still getting used to it. Okay, I'm gonna do kind of your jugular pulse at your neck, both at the same time. Okay. All right. Does that feel okay? Is there too much pressure? Okay. And can you just take a deep breath in for me? Good. I'm gonna feel your glands. Can you swallow? Okay. Your lymph nodes feel fine. I don't see any swelling or feel any swelling. Has your throat been feeling fine lately? No problems? Okay. And your pulse seemed just fine as well, all around. And it was easy to find, thankfully. Sometimes I still have trouble on the wrist. Yeah, I don't want to like hurt the person, but you have to kind of press pretty hard to feel it sometimes. Yeah, okay. Let me think what's next. I'm just gonna take a look at you now. Look at your face. How has your skin been lately? It looks great to me, but have you noticed anything different or about the same? Okay. You have combination skin? Okay. Oh, okay, yeah. I get you. Okay. I don't see any bruising. I don't see any cuts to note. We're supposed to look for rashes and any major signs of asymmetry. And I really don't see anything. You look great, just like you always do. Well, you know we gotta be fine. Don't see anything. How have your ears been? Has your sense of hearing been diminished at all? Do you have any popping? No. Any ringing? Once in a while? Okay. Alright. Can you hear this on both sides? Yeah. Okay. Just tell me which side you hear the noise on, okay? Yeah, so you can say left or right. Okay. Both. Good. Good. Right. Good. Right again. Great. Left. Right. Left. Good. Okay. You're fine with that. I am gonna take a quick peek into your ears really quick. And just see if I see anything strange. I'm gonna grab the back of your ear really quick. Pull a little bit. Does that hurt? No. Okay. Color looks normal. I don't see any excess wax buildup. Just gonna come to the other side now. Okay. I'm gonna grab the back of your ear again. Okay, that doesn't hurt. Good, okay. There's a little bit of redness around your ear. Okay, it doesn't hurt or anything though. Alright, and no excess wax buildup on that side either. So that is great. Have you been like using a Q-tip or maybe unknowingly touching your ear right here? Do you wear headphones a lot? Do you wear earbuds or do you wear headphones that go over your ear? Both. Do you do that every day? Okay, so you wear the earbuds when you work out, walk, stuff like that. Okay. And headphones when you're at home. Are you having to use them for work right now? Okay. Yeah, it's definitely important to give your ears a break from those. I know sometimes we can't if it's a work obligation, and I love listening to music while I exercise too, so I definitely get it. And I'm trying to think if there's any real way that we could get back on time, but kind of right now it's just how it is. If there are any times though where you can either play sound out of your speakers or just take your headphones off for a little bit to give your ears a break, that will be beneficial in the long run. Yeah, because they can get really tender really fast. Okay, cool. Alright, let me think. I'm glad I'm doing this with you because sometimes I forget what's next. Oh yeah. I need to look in your mouth and your nose. Is that okay? Don't worry, I've already seen your boogers a million times. Okay. If you just want to tilt your head back a little bit for me. Okay. Your nose looks fine. I don't see any redness, which is what what I'd be looking for if you had some sort of infection. Can you stick your tongue out for me? I'm gonna use the stick, and I won't be mean. I'm gonna use this just to hold it down. So, just look around a little bit. Okay. Can you show me your teeth? Okay. Alright, mouth looks good. Teeth look good. Looks like you're keeping them clean. Do you brush at least twice a day? Mm-hmm. Do you floss ever? I don't really that much either. Okay. Do you use a water pick or anything like that? Yeah, okay. Those are nice. I definitely want one. Yeah. Okay. And have you bitten your cheeks at all recently? Do you bite your tongue or cheeks a lot when you eat or talk or anything? Once in a while. Does that ever turn into like a cut or a sore that takes a while to heal? Sometimes, not usually. Okay. Alright. Good. Your tongue looked healthy as well. I didn't see any whiteness or any strange bacteria. You're still not smoking, right? Okay. And I think you just drink like every once in a while, right? Yeah. Okay. No problem. That's definitely right in the range that's perfectly appropriate for your age, so no worries there. Okay. Alright. Next is going to be your eyes. Have you noticed any changes in your vision? Sorry. Okay. Have you been staring a lot more at a computer, phone, tablet? A bit, okay. I feel like that's kind of inevitable right now, but we definitely don't want it to be doing any long-term damage on your eyes. So I have a Snellen chart here, which is the letters that you see at the eye doctor. Yeah, do you go to the optometrist every few years? You're definitely supposed to go every year. They have these really cool cameras that can take a picture of your eyeball now and just make sure that you're healthy. Your eyes actually are like really connected to the rest of your body, oddly enough, and they can get a reading on a lot of things, diabetes, certain cancers, and they can make sure if you have any freckles on your eyeballs that they're not growing, things like that. So it's actually pretty beneficial, and they can spot things early if you're at risk for certain diseases. Yeah, so you know, you don't have to go, I can't force you, but it is a good idea. Okay, cool. I'm gonna move to the side. And okay, can you see that? Alright, I'm just gonna point at the letters, and I'd just like for you to read them for me, okay? You can use both of your eyes. Okay. E, good. C, R B M N. Okay, good. Can you cover your left eye? Okay. O P J. Good. Q. Okay. Can you switch and cover your right eye? Okay. T. X. H. Good. D. Okay. Okay. Both of your eyes again. What color is this line? Green. Good. And this one? Red. What's the smallest line that you can read? Okay, let's go for it. L. Okay. U. T. Good. S. Great job. Do you want to try the one under it? It's okay if you mess it up. It's a C. G. Good. V. L. That's a K. Okay, cool. You have really good vision. And I'm glad that you could see the difference between the red and the green as well. Sometimes if the optometrist is worried that you're colorblind, they'll do an extra series of tests, but I don't have access to those yet, so if you don't hate this and you don't mind helping me again, I think in a future homework I'm going to have to practice those because they're part of some of the testing that I'll be qualified to do eventually in my job. Yeah, so we will likely do those another time. Okay. Alright, we're gonna do a bit more with your eyes now. Okay. Can you see all of my face right now? Okay, can you see my finger over here? And how about here? Yeah. Okay, just keep staring at my face. You can look at my nose, chin, mouth, eyes, whatever. And I'm gonna wiggle one of my fingers, and if you can just tell me which one is wiggling. Left or right? Okay. Right. Left. Left. Right. Okay. Right. Left. Good. Left. Left. Good. Can you still see them? Okay, right here. Alright. Right. Right. Good. Left. Right. Okay, great. You did great on that. I'm gonna bring my fingers into your field of vision now. Yeah. And you're gonna do the same thing, just look kind of straight ahead and let me know when you can see my finger. Okay? Alright. Good. 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 Great. Good. Okay. Good. 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 Okay, good. Cool. We're gonna do the opposite now, much slower though. I'm going to pull my fingers apart. Pull my fingers apart. Yeah, that's cool. Pull my fingers apart, and once you can't see them, just let me know. Don't make fun of me. Okay, ready? Just keep looking straight. Gone? Okay. And do the same thing up and down. Ready? Gone. Okay, cool. And on the diagonal. What was next? Oh yeah, flashlight. Okay, so I have this light here. I'm just gonna have you look at my finger and then look at the light. So I'm gonna move my hands around and you just look at whichever one I tell you to look at, okay? Alright. Can you see my finger? Good. Can you see the light? Good. Okay, so this time look at the one that I tell you to look at. Okay. So look at my finger and look at the light. Look at my finger and look at the light. Good. Look at my finger. Look at the light. Good. Look at my finger. And look at the light. Okay. Look at my finger. And look at the light. Okay, good. You can blink. I know that's kind of bright. Okay, I have to do one that's a little brighter. I'm sorry. Okay, so I'm just going to look and try to see as far into your eye as I can. So you can look straight ahead, whatever that is. I'm gonna get pretty close to you. So yeah, it's gonna be awkward, don't worry. At least we know each other though. I'm not totally ready to do this with a stranger. Okay, so just look straight ahead as much as you can. I'm gonna put the flashlight right into your field of vision, and I'm gonna get really close to your head so that I can try to look inside of your eye. Okay. Alright. Okay, so here we go. Okay. Looks pretty good on this side. Okay. We're gonna do the same thing on the other side. Alright. Okay. Good. Alright. Just another second. Okay. Alright, good. Sorry about that. I know you can blink some. Okay, good. Okay. Now I'm gonna get you to follow the flashlight's beam. Yeah, we'll put it away after this, sorry. Okay, ready? Just follow it. Yep, eyes only. Are you seeing any depth of vision? Looks normal. Okay, good. Still looks normal. Okay, good. That was great. Your eyes look really healthy. Sometimes there's like a cloudiness when you look in there, which is a bad sign, and some people can't keep their eyes tracking the light or can't move them from one spot to another. And I was also looking into your eyes from a distance there. Everything really looks fine to me. I didn't see anything that I feel like was worrisome. Your eye is a little red on this side, but that could just be from increased looking at computer screens. I don't know how your sleep has been. We should probably talk about that. I probably should have asked that a while ago. How has your sleep been? Could be better. How much would you say you're sleeping per per night on average? Okay, so sometimes it's less. Okay. And are you napping at all? Sometimes, okay. How long do your naps usually last? Okay. Yeah, 20 minutes is like the sweet spot. Usually if you lay down, set like a 25-minute timer, give yourself 5 minutes to try and fall asleep, and then 20 minutes to sleep. Then you won't wake up feeling very disoriented. Yeah. Oh yeah, it'll still totally help. Even if you can't fall asleep and you just lay there for 20 minutes, it has major benefits for your body. As long as you're in a resting state, you don't have to actually fall into a deep sleep. Yeah, it's pretty cool. It's like recharging. Okay. So yeah, I would just say it's probably a mixture of not as good sleep and screen usage that's making your eye a little red on this side. It was almost more pink. Yeah, it doesn't hurt though. Okay, cool. And how about your exercise? Have you been active at all? Okay, so you do walks sometimes and some workout videos. Okay. Do you swim? Okay. Alright, cool. Alright. So next I'm gonna just have you do some faces for me. Okay. I'm gonna be testing like your muscles essentially in your face and making sure that everything's working properly. Yeah, okay. So can you puff out your cheeks for me? Good. And puff them one more time. Nice and strong. Good. Okay. You can relax. Alright. Can you do just one for me? Good. One more time. Good. Other side. Good. One more time. Good. Okay. I'm gonna put my hands on your shoulders and I just want you to shrug them up. Okay? Alright, shrug for me. Good. Relax. Okay, one more time up. Good. Okay. Alright. Okay, can you raise your eyebrows for me? Okay. And can you lower them? Okay, cool. Can you wiggle your nose, like kind of crinkle it? Okay, cool. Let me see. Can I get you to smile without opening your mouth? Okay. Don't open your mouth. Okay. Okay, now you can open your mouth. Okay. Can you shut your eyes really tight? I'm gonna use my fingers to try to open them, but don't let me, okay? Okay, good. Alright. I'm gonna put my hands along your jawline here. And I'm just gonna feel around your jaw. And then I'm gonna hold my hands on the side of your head like this. And I'm gonna ask you to open your jaw for me, okay? Alright. Have you been having any tenderness? Any pain when you're chewing? No? Okay. Alright. Now can you open your jaw? Good. Close. Good. Okay, can you close one eye? And the other? Okay, blink for me 5 times. Good. Okay. Looks really good. Can you do your eyebrows up for me one more time? Yeah, we're supposed to feel for the muscle structure here, so I want to make sure that I am doing this right. That's the good thing about practicing. I can ask you to do it more than once. And you not get suspicious of me. Okay, I'm gonna put my fingers on your temples and just circle them. Does that feel okay? Does the pressure feel equal on both sides? Okay, good. Alright, let me think if I'm forgetting anything. I don't have the smell test yet, so probably around the same time I have the colorblind charts. We'll do those together. If you're willing to, I should say. And we'll probably do taste then too. We haven't really gotten into those yet. We did your hearing. Oh, you know what we didn't do is memory. Okay, so what I'm gonna do is I'm gonna speak some numbers into your ear, and then when I'm pulled away, just tell me everything I said. Okay, cool. I won't do it too hard. Okay. 17, 28, 100. 17, 28, 100. Good. Okay, other side. 13, 56, 8. 13, 56, 8. Good job. Sometimes the numbers are harder for people because they're so abstract. We also do like words. Do you want to try that? Okay, cool. Alright. Purple temptress castle. Purple temptress castle. Good job. Forest mushroom cat. Forest mushroom and cat. Good. Maybe I'll get extra credit for doing both. Alright, your memory seems just fine. Okay. Just making sure I went down the checklist. Okay, the only thing I haven't done yet is the measuring. This is the part that I'm most scared about. But I do have to measure just a few different points on your face, and technically this is to do with the symmetry aspect. But also they're starting to figure out that certain issues can make parts of the face, I don't know how to explain this. So like, if there's a ratio difference between the spaces on your head that are supposed to be roughly equal, either to each other or in proportion to your whole face, that could be indicative of some sort of illness. I don't entirely know all of them yet, but I do know that swelling of any sort, head trauma, can be figured out this way. And then if you have any sort of tumor or growth, anything like that, that will create a difference that might not be visible. Yeah. So it's just a more precise way, essentially. Yeah, okay. So you can really just relax. This should be weird but easy for you. Okay. So I'm just gonna measure from the side. Okay, good. The other side, same thing. Just to your hairline. Okay. And now I'm gonna do across your chin. Okay, and lips. Okay, and nose. Okay, and now your forehead. Alright, I'm gonna do from your eyebrow line up. Okay. Other side. Okay, I'm gonna do from your ear down your jawline now. Okay. Looks really good. And other side. You're looking very symmetrical. Okay. And I'm gonna get from ear to ear now. Okay. Good. Alright. Let me think if there are any others I was supposed to get. Oh yeah, I have to get from under your nose to your chin as well. Okay. Okay, good. Alright. Everything is really symmetrical and everything is in proportion to itself as well. I know I'm not explaining that well, but I hope it makes sense. Yeah, if you have like a crazy wide space in some area that doesn't match really with the rest, then that could be an indicator. So, okay. Yeah, you look totally normal. Okay. Can I get you to sign this? Yeah, it does right here. Okay, thanks. And I will sign as well. And what's today's date? April. Okay, you're right. Okay, cool. Well, that was everything. Not too bad, right? Did you have any questions for me? Okay. Yeah, I would say if you do experience a ringing in your ears often, like more than once a week, or even once a week really is kind of a lot. It does happen randomly sometimes for everyone, but it could be two things really. Some people that have a TMJ disorder, so an issue with their little bone that joins at their jaw and ear, that can give you ringing in your ears when you're grinding your teeth a lot. So do you know if you grind your teeth at night when you sleep? Maybe, okay. Yeah, if you're causing any sort of tension in your jaw, that could be doing it. And then the other option, of course, is something going wrong with your ear. Yeah, essentially there's like an imbalance in there, and your ear can't pick up on certain frequencies, I think. So it creates a frequency, which is weird. You think there'd just be silence, but unfortunately not. Yeah, I would definitely try to narrow down the problem first. Your dentist can tell you if you have a TMJ problem. Cool. Okay. Did you have any other questions for me? Okay, cool. Well, I know you said you had some stuff that you wanted to talk about, and we can definitely get to that if you want to. Yeah, why don't we just go like chill on the couch and you can tell me what's going on. I know. No, it's okay. Honestly, like, I've had a few little breakdowns crying and whatnot, but for the most part I'm holding it together, so I definitely have the energy emotionally to be there for you right now. Yeah, so come on, let's go sit and you can talk to me about what's been going on with you.